Thank you very much, Masoud. Dear co-chairs, dear colleagues, dear friends, I'm very glad to be able to join the conference, and although I would definitely prefer to be in person in Riga, not only because I enjoy in-person interactions, but also because I love Riga, even in these snowy conditions. Now I will start my presentation. I hope you can see my slides. And so basically, a few days ago, I was asked to prepare a presentation on already defined topic about working together towards HIV viral suppression, tuberculosis treatment, and HCV cure. And I started thinking what they mean by working together, who with whom. And I will present my reflections today, I will say brainstorming on this topic. So, do they mean disease-specific programs working together, like HIV program, TB program, viral hepatitis program, or we are talking about WHO with our other international partners working together? Or are we talking about research, the research communities and practice implementers working together? Or we are talking about WHO international partners working with national counterparts. But it can also be related to governments and state institutions, international partners working with non-governmental organizations, civil society organizations, community groups. And actually all the aspects and levels of working together are very important. And I will provide few examples in each of these directions and some of my reflections. Of course, many of them will be related to WHO. So we all know that in many of our countries, if not in the majority of the countries, we have a very strict vertical programs responsible for providing care for HIV infection, for tuberculosis, for STIs. They are not very much integrated, although we know that HIV, viral hepatitis, STIs, sometimes tuberculosis in some areas have shared common modes of transmission, determinants, and risk populations often have the same risks for 3 or more diseases. Services, unfortunately, are offered in different locations, making it more complicated for people to be able to access the services. And unfortunately, in many settings, in many areas, the services are not typically delivered in the primary health care setting. And it leads to many consequences, and we are lagging behind. I'm sure that you've already discussed this problem about, for example, coverage of TB preventive treatment or very low success rate of treatment success among HIV positive TB people suffering from tuberculosis. And recently, WHO published a framework for collaborative action on tuberculosis and comorbidities, a very comprehensive document, actually, with the aim of addressing health-related risk factors and comorbidities among people with tuberculosis. And it is underlined that to achieve this, care should be organized around the end user rather than respective diseases. It provides very thorough reflections and regarding this framework, and going from principles to actions, interventions, and making impact. It is available on WHO website. I won't be talking more about it. And what was recently published also by WHO, it's global health sector strategies. And as you can see, these global health strategies in one document on HIV, viral hepatitis, and sexually transmitted infections for 2022-2030. The same about recently updated consolidated guidelines for key populations. As you can see, it's also consolidated guidelines on HIV, viral hepatitis, and STI preventions. And following that logic about integration of all different diseases with sometimes common modes of transmission or united the same key populations, in WHO European region, recently was adopted new regional action plans for AIDS and the epidemics of viral hepatitis and sexually transmitted diseases for 2022-2030. So instead of having separate documents, we are now talking about joint actions. And one of the strategic direction one, it's a shared response to all these diseases within universal health coverage and health system approach. I will not be staying a lot on this, but I would like to mention that many updated or completely new guidelines regarding these diseases include the areas of decentralization and integration, sometimes simplification, moving towards a primary healthcare level. Very important area and direction, it's about triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B. I would like also to mention policy briefs and new HCV recommendations to be about simplified service delivery, point-of-care diagnostics, and treatment of adolescents and children. And recently updated guidelines on PrEP, about differentiated and simplified pre-exposure prophylaxis of HIV prevention. It also reflects on simplification and of PrEP provision, and as well it updates our concern about hepatitis B among PrEP users. All these documents are available in English on WHO website, and now they're in the process of being translated into Russian language. Another aspects of working together, it's about WHO working with other international partners. And there are many examples existing mechanisms. For example, UNA SUBRAF mechanism of joint planning together with all co-sponsors. Or, for example, working together with countries' government, ministries of health, and medicines patent pool, farm industries regarding expansion of voluntary licensing in order to improve access to modern, effective, quality-assured medicines and technologies. And it's needed for all three diseases: tuberculosis, hepatitis C, and HIV. It's very important of working with donors and ensure that supported activities by these donors are in line with WHO recommendations and evidence-based, that donors support programs for joint and integrated referral, testing and care for all three epidemics. And it's actually very pleasant for me that Global Fund now also provides funding for some activities with viral hepatitis, regarding viral hepatitis. I would like to mention that a couple of years ago, the United Nations Common Position on aiding HIV, TB, and viral hepatitis through intersectoral collaboration was signed by 14 UN regional directors. And it was prepared by WHO European region under the leadership of Dr. Masoud Dara. Many actions areas were identified for mutual advantages in coordinating across sectors and tailored to the countries. And all of these issues are very important even now. They were looking about determinants of health. We know that they cannot be influenced only by health sector, but they are very important for early diagnosis, access to treatment, care, adherence to treatment, so access to social support, rehabilitation and treatment outcomes. Next area of working together, it's research in practice. Probably it's more important for the participants of today's conference. And it's not only about supporting evidence-based evidence-informed practice, but also about operational research and implementation science. You all know I will not be talking a lot about grading of recommendations, assessment, development, evaluation that is used by WHO, but I would like just to mention that all WHO recommendations are now based on some levels of evidence, either high, moderate, low, very low. But it's not only the quality of evidence that influences the decision about the strength of recommendation. It's also values, preferences, resource implications, priority of the problem, and of course acceptability and feasibility of implementation. And based on this, WHO makes recommendation either strong recommendation or conditional recommendation. But even if we have very strong and evidence-based recommendation, it's not always that they are easily implemented in our countries. So even when interventions are designed in similar ways, implementation occurs differently in different contexts and with many different effects. And here we are moving to implementation research in order to promote the systematic uptake of research findings and other evidence-based practices into routine practice. And here WHO provides implementation research toolkit and both a workbook and facilitator's guide, and it's very important to move with to increase the coverage of implementation research in our countries in different aspects. Very important operational research to increase the body of evidence and knowledge with interventions that are most effective, and WHO supports many operational research. I can give here the example of shorter treatment regimens of MDR TB, or operational research that is now ongoing on concomitant management of hepatitis C and MDR TB. That is also done in Eastern Europe, Central Asian countries. Next, it's working together between international partners and national partners. And here many examples of very successful interactions between international partners and parliamentarians, ministries, judges, and many other examples regarding different aspects: decriminalization, sustainable funding, advocacy, political commitment, including using United Nations Sustainable Development Cooperation Framework. And example, MAF-TB, for example, which is implemented now, or for example, the Eastern Europe and Central Asia Regional Judges Forum on HIV, human rights and the law, and we have recently participated in the 4th meeting that took place in Tbilisi. And final direction of working together, it's about different partners, government, international partners, and working with NGOs, civil society organizations, and community groups, because they have a really crucial role in ensuring treatment adherence and prevention of losses to follow-up for all diseases, especially that require long-term treatment, HIV, tuberculosis. But they are usually more flexible in difficult circumstances. And the war in Ukraine recently showed how civil society organizations, NGOs, can really play a crucial role in sustaining provision of care in war condition and monitoring the situation. and helping not only within Ukraine, but also for refugees who are leaving the country and who needs continuing treatment, etc. It's a really great example. We have very good example of country coordinating mechanism, working with the Global Fund, and also regional collaborating committee that on accelerated response to TB, HIV, and viral hepatitis that organized by WHO Europe. But it's also very important to work with communities on community-based research, because community-based research together with advocacy can lead to social transformation, to strengthen the community and transform the results into action in the form of practical field intervention. It's very important that now WHO not only recognizes, but actively involve civil society in development of recommendations, and recently published consolidated guidelines for key populations were done together with a community-led based, including on community-based research. And my final remarks will be that we need to make use of existing processes and mechanisms. There are plenty of them. I mentioned only several of them. We do not need to create something new. We need to make sure that the existing processes and mechanisms are widely used and implemented. Of course, we need to implement the updated WHO guidelines and tools. We need to look into regional action plans on TB and HIV, viral hepatitis, and STIs, and make sure that they are reflected in national strategic plans in the countries. We need to fund national responses and decentralized services, including testing and treatment. Of course, we need to share experience and good practices across the region. You know, it's very competitive, usually countries, when they look at each other at different regional meetings and they see that their neighbors are implementing and moving ahead. It's a very contagious, actually, to do something successfully. And of course, ensuring close collaboration with community and civil society organizations at all levels and all stages. I like this saying about coming together is the beginning, staying together is a progress, and working together is a success. And I'm sure that we have all tools now needed in order to make our interventions successful. Thank you very much for your attention.